Hi there, this is Dr. John Carrozzella from the Florida Center for Hormones and Wellness in Orlando, Florida. And I'd like to take a minute to talk to you today about this concept of laboratory values and when they're considered normal and when they're considered optimal and what the difference between those two things is. So when we look at a lab slip, we're going to oftentimes see a range on that lab slip. And that lab slip range is nothing more than a statistical average of a group of people. That is, if you take some adults between the age of 18 and 65 and you put 1,000 of these people in a room without any symptoms related to that particular lab test being looked at, and you measure those laboratory values, what you're going to determine is there's going to be a wide variety of numbers that's going to over time create what's called a bell-shaped or normal curve. And there's that word normal. Normal means 2 standard deviations about the mean of a bell-shaped curve. It says nothing about quality, best levels, optimum levels, ones that we do the best at. It's purely a statistical average of a group of people. And that does not at all tell you how well people do, because mistakenly, a lot of people believe that hormones are like an on or an off switch. That you come up to a number, they start to work, then you get to another number, and then bad things happen. That's not how hormones work. Think of hormones more like a dimmer switch. That is, as they come into the range, they start to work, and then as you increase that dimmer switch, they may work more and more and more and better and better. And every individual is going to have a different optimal level. That is, that number is going to be very different from person to person to person. And whatever that optimum number is, it really depends upon whether or not they're getting any benefit and whether or not they're having any side effects. I don't even like the word side effects for hormone therapy, because really all that you're seeing are the things that the hormones actually do. So I prefer to use the phrase excess effects. That is, you're getting too much. Like, for example, testosterone in women. You might see some oily skin, you might see some acne or denser hair development or growth. Well, those are normal things that testosterone does. They're just like too much of it. And you have to balance that against the effect that you're getting in the good things in terms of libido, self-confidence, energy, focus, concentration. So that number at which you perform the best, man or woman, that level, it may be above the range, it may be at the range, it may be below the range, it may be wherever on the range. But what is optimal for you. Now, what's important when you want to start talking about using whatever levels that may be working, you want to look very carefully at the medical literature. And when you look at the medical literature, you want to define if it says that there's a level at which you can start to do some damage. And what you're going to find out with the everyday hormones that we use in this office, that is estradiol or estrogen, testosterone, progesterone, and thyroid, there's very little adverse evidence to show that when you're using them in functional ranges to make people feel good or feel at their optimum, you cannot cause significant medical harm. So what that ends up meaning is that we can seek out that optimum level or that best number or that best level in their blood, that they get the best result both for vitality, physical function, and metabolic balance, and yet not have any of the excess effects that I mentioned earlier. That is, we go for a level that's going to get the job done. And we know by studying the medical literature that we can't hurt people with hormone levels within the functional ranges that we do. So I can tell you that there's a big difference by this term optimum. We're always striving for the optimum level, and many times it has nothing to do with the so-called normal level on the lab slip. This is Dr. John Carrozzella from the Florida Center for Hormones and Wellness.